Hi, this is Christine Crow here, and welcome to my channel. Today I want to talk about what's in the news really. It's about the NHS staff confronting the Prime Minister and also the Chancellor, Rachel Reeves, as well. And I talk about this because I think it's really important just to get everyone's different point of views. And this is purely my view from what I listened to. I'll put the link here regarding this. It really is about the NHS, how they're facing the biggest crisis in decades. And there's staffing issues. There always has been, but it's going to be even more accelerated. I believe so. And, with the times, it's really spiraling, possibly out of control. Now, the NHS staff talked about how exhausted and tired they are and overwhelmed, burnt out. And I could really feel that from them. And it saddened me to see that. And what I'm worried about is that, yes, the NHS staff can put in their feedback, and it's good that the Prime Minister and Rachel Reeves listened to the healthcare workers, for example. They listened to them, but we really need a better solution, and we need it to be faster than what it is, than just let's just put this information into a consultation and put your feedback, give us your feedback, which is really brilliant. I'm not having a go about that, because they do need to hear from the real people rather than the Parliament's point of view. But what I'm concerned with is that they were talking a lot about AI and how they're going to be using AI to, the technology to assess things and do preventative. But we've still got those that are suffering right now that really has gone past that stage. So what about those that have gone past that stage of preventative and have the diagnosis and need the care? What about the service users and patients and the healthcare staff looking after those that are very, very vulnerable? But now the healthcare staff are actually vulnerable too. And it worries me that there's not a fast solution. And I don't understand why we're sort of not talking about agency, using agency staff as a temporary solution whilst we sort out the permanent solution, i.e. permanent staff members to be in place of the temporary workers. Or at least, why was that not talked about? We're recruiting. We're really going on this recruitment drive and really looking at employing the healthcare workers and nurses, because at this rate, no one's going to want to work in the NHS. We're going to lose people. We're losing people already. People are leaving in thousands, basically, because of their wellness and their mindset. They value that more. Because at the end of the day, it's like the pilot always says, right? Put your mask on first before you help other people. Well, this is happening the other way around because of the nature of the healthcare professionals. They want to help, but they're also putting themselves at risk. So it talks about that the pay is going to be increased, and really that should have happened years ago. It should have happened years ago anyway, and I think that may have stopped people from leaving from years ago. It also, the Prime Minister and the Exchequer talked about that money has been unaccounted for, that really could have paid for the staff members. And yes, there's equipment that needs to be done, upgraded. But what about the staff members? How is that going to really, truly help the staff members with their day-to-day? Now, the NHS talked about the solution regarding the crisis, and they said to everyone that, you know, we are looking at this, we're looking at the openness of what the healthcare workers had said to them. They're taking that on board, but I still didn't feel that the solution was given a time frame. And I know it's hard to do that, and I know that they're putting everything into this consultation hub, but what is the outcome going to be from that? That's the next thing that I would like to hear from the Prime Minister, for example. And the Prime Minister has done really well. Both of them have done really well. I take my hat off to Rachel Reeves for what she said yesterday in the budget, or Wednesday in the budget, for example. Amazing. And she gave an amazing speech for a woman. Not for a woman. She did an amazing speech, speaking from a prime minister's point of view, but also from the Chancellor's point of view. And I believe she's the first woman that ever delivered the budget in the way she did, with having to deal with all of the crises and the backlog. She did an amazing job there, and I take my hat off to her. Well done, Rachel Reeves, for that, because that was a mammoth task for you to be able to deliver such an amazing speech. That was wonderful and great. But I just feel that there's a bit of a lack with really answering some really strong questions, because from what I was listening to with the healthcare workers, they need this help now. We need to help now, not months, 6 months down the line, or a year down the line, or 4 years down the line. We need the help now. They need the help now. So I would have liked to have known the immediate outcome. What are they doing immediately to relieve the staff members that are working overtime, that are at burnout? What are they doing immediately? Yes, there's the AI technology, which is wonderful and great. And, you know, that platform is going to do really well. But I'll explain an example which I witnessed myself when I was in the States last year. There was a few robots were there, and the robots were on the floor looking after the vulnerable people in their rooms. One robot was allocated to a patient who was very, very ill, for example. And that was my brother at the time. He's passed away now, my twin brother. And what I noticed was that a robot can't be human. So the healthcare workers, there was one healthcare worker on the floor delivering the care. And there was these robots in the room, monitor robots. They were in the room, and if you moved, they would tell you to sit down. It wasn't very nice, to tell you the truth. I didn't like it myself. And some of the staff members, they were working and they were doing 16-hour days. How do I know that? Because I was there with my brother in the room, in his hospital room, for example. So I knew that person didn't go home. And I said to her, I said, why are you still here? You should have gone home. I said, you're doing more than 12 hours. And she said, well, I volunteered to do it. I said, but even if you have volunteered, it's still not right that you're doing this. And I don't want it to be the case where we're having these robots who are monitoring. And don't get me wrong, where it's needed, it's very good. If it works the way it's meant to work, it will be really, really good. But if it's there to replace staff, then I'm a bit I'm going to question that, because I've seen the back end of that, the experience, the care that can't be given, and then you're having to wait because of the shortage of staff. So therefore, people's dignity is being affected. as well as, the privacy. Yes, the robot couldn't see in the bathroom, but, still privacy of conversation, privacy of, talking to your relative, and the robot is actually interfering in your conversation. When I say a robot, it's a staff member who is sat at a, a nurse station with monitors, like a security guard watching all of the different rooms. They're flashing, yeah? And if someone gets up who's vulnerable, then the attendant, the technician, will tell the patient to please sit down, for example. However, there's got to be a better solution than this, because what I saw today, and I looked at the video, and I looked at their faces, the healthcare workers, doctors, nurses, healthcare staff, I saw that they were exhausted. I saw they were tired, and they're having to try and keep a strong face to explain how they feel without breaking down and crying. But I could feel it inside that they were breaking down. So Councillor Reeves and the Prime Minister, I want to know, UK wants to know, what are you going to do immediately to help alleviate those staff members that they look tired, they're burnt out, they're exhausted. It made me cry looking at their faces when they were talking. They were very professional, don't get me wrong, but my goodness, when is it going to end? When are they going to get some immediate help? They need immediate help. They don't need to be, they've already said what the problem is. And it's going into this hub, this consultation hub. It's going to take a while to sift through all of these questions that they've got from thousands of hospitals. What can we do now to help, to stop this burnout and stress and mental health? What can we do? What can we do as a nation to help this? Because what I saw today, it did not make me feel good. Yes, the speech, they spoke beautifully, they answered the questions perfectly, but they didn't really answer the question. I still was left wondering, and I was worried for the healthcare professionals there. I was worried through what they were feeling. There were things they probably weren't allowed to say, I don't know, but I'm just speaking, I could sense that there's a lot of problems that needs resolving now. Yes, it's great that the cavalry has come in and they're going to help, but what about now? What is going to be done to help the healthcare workers and healthcare professionals working on the front line from being exhausted and burnt out? Who's going to help them now? Because from what I saw today, this cannot continue any longer. And yes, it's wonderful that they're getting a pay rise, but that's not gonna help that feeling. That pay rise should have happened years ago, not held back, because people would have stayed if that's the case. So what has happened with this recruitment drive that you've done? Where there was sponsorship, what's happened? It's like it's disappearing. So I just wanted to come on here to do this quick video just to talk about the effect that I could see, that so many departments have got questions a lot of departments have got questions that they need answering. And one department and another department who's already strained and exhausted, how are they going to help one another when we need more people on the ground? And I'm not saying this to, that you to run out there and you must pay for agency staff, for example, although it is needed. But we must look at what the situation is. And this, to me, is urgent need. So really, there should be some sort of agency, the contracts that you've got, where you've got providers, they need to be brought in, not held back and wait till people fall at the side before you start bringing in the cavalry to help them. That's too late. Let's do this now, whilst you're working out how you're going to deal with this hub, how you're going to deal with this consultation, how you're going to deal with all the questions coming from thousands and thousands of hospitals, and you're putting it all into one area, and then you've got to sift through them and then prioritize them. We don't want to lose people. The NHS don't need to lose any more people. People are leaving, people are moving abroad. Let's try and keep people in, and let's try and work together with how we can work out a short-term solution whilst the UK are working on the long-term solution. Because you've already lost billions of pounds unaccounted for, which could have gone on agency. And I'm going to say it, even though you don't want this to be the term to be used. But there's got to be something that can be implemented now, because this is urgent. It's a crisis. We haven't got, the UK doesn't have time to be waiting for the parliaments, for example, to come forward after going through all of these sifting and questions and different departments. It's going to take too long. And how many people will face burnout? How many people will be affected with their mental health, their wellness, their body breaks down, disease? How many people do we have to lose in order to listen? And this is my concern, is that I'm really pleased that a step has been taken in the right direction. And I know it's going to take time. I'm not saying that I don't understand that. But what is the emergency solution that you can provide right now whilst you're working out all of these things? What are you using the funds for example, that could be used as a temporary emergency fund? So I just wanted to give my take on the video that I saw today with the Councillor Exchequer, Rachel Reeves, and also the Prime Minister as well. And I just wanted to reach out to you all and just put your comments here. What did you think about the speech? It was great, don't get me wrong. I'm not having a go at that speech, but I am listening to what those nurses and doctors said, and looking at their faces today, for me, it was a bit distressing to see that they are really trying their best. They're working really hard. All of them are working really hard. But you can only do so much for so long. And then burnout kicks in. And we want to stop. It stops. We've got to stop it now. Can't let it carry on. It's too much. Too much. All right, so thank you so much for listening to me today. Hope I didn't go on too much, but I just wanted to come on here just to give my feedback from the video that I watched today regarding the NHS staff members, how they confronted the Prime Minister and the Exchequer as well, the Chancellor as well. All right, so thank you so much. Have a wonderful day, everyone. Stay blessed. Bye.